India has confirmed 5 cases of HMPV virus, with the latest 2 cases coming in from Tamil Nadu. Earlier, 2 infants tested positive in Karnataka's Bengaluru. The affected children, an 8-month-old and a 3-month-old, both had a history of bronchopneumonia and no recent international travel. The other case has been detected in Ahmedabad, where a 2-month-old has tested positive for the virus. Karnataka government has issued a health advisory urging people to wear masks in crowded places. The central government, on the other hand, has reassured the public, stating that HMPV is not new and has been circulating globally, including in India. Listen in to the health minister.
On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research and the National Center for Disease Control are keeping a close watch on the situation in China as well as in their neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed, and no surge in any of the common respiratory viral pathogens is observed in India. There is no reason to worry.
But despite these reassurances, public concern is growing. People are worried about this new virus, especially with the memories of COVID-19 still fresh. Is HMPV the next COVID-19, or is it just another seasonal illness that will pass without much impact? Take a look at these FAQs.
What is HMPV?
HMPV, or human metapneumovirus, is a respiratory virus. Unlike COVID, which came up in 2019, HMPV was only discovered way back in 2001.
What are the symptoms?
The symptoms are that like any other normal cold or any other respiratory illness: a cough, runny nose, fever, sore throat, wheezing, or shortness of breath.
Can HMPV lead to hospitalization?
Yes, but only in certain cases, namely for children and immunocompromised people, and also senior citizens above the age of 65.
How can HMPV be prevented?
HMPV can be prevented the same way we learn to prevent COVID-19. Mask up, avoid touching your face, especially your eyes and nose, with your hands, and wash your hands thoroughly with soap for at least 20 seconds.
Is HMPV similar to COVID?
There is one key difference. COVID is known to mutate into several strains, but HMPV has shown no mutation since 2001. Moreover, COVID spreads the year round. HMPV peaks only during winter and spring.
Can HMPV cause death?
Yes, but only in susceptible individuals with underlying conditions.
How can HMPV be treated?
There is no specific antiviral treatment to take care of HMPV. Instead, what you do is to manage the symptoms, whether it be a running nose or a sore throat.
Is there a vaccine against HMPV?
No, as of now, there is no virus that exists which can prevent or negate an HMPV infection.
If I get infected, when do I get tested?
Only if you're facing severe respiratory symptoms and which have persisted for at least 3 to 4 days.